Sherry, we've been talking about Cranmax for urinary tract infections. How common are they? How do you get urinary tract infections? And what can you do not only to help relieve them, but to help prevent them?
Well, urinary tract infections, another name is bladder infection or cystitis, are actually a very common concern, especially among women. It's actually the second most common infection that women suffer with every year. It's estimated that about 20% of women will have a urinary tract infection every year. And for some women, it's recurrent. They get a couple of urinary tract infections every year, and it can mean lost days of work. It can mean unpleasant symptoms and suffering. So I think it's important for people to understand that there are options available for prevention. There are things that we can do, supplements that we can take that can strongly support the benefits of our urinary tract.
You say that a woman may get them regularly, or how often would somebody end up getting a urinary tract infection? Is it something that's every couple of months, once a year, or is it something that's really chronic with a lot of people?
Well, it depends on the person, but I know in my practice I've had women that seem to get them every month or every other month. And often when you get a urinary tract infection, the only way to get rid of it is to take an antibiotic. And I think that people today are aware of the concerns of taking antibiotics, the side effects, the issue of resistance, developing yeast infections. And so what I've seen is a lot of women and men as well are interested in prevention of urinary tract infections. And there are options today. In fact, Cranmax has been clinically studied and found to be very effective as a preventative for urinary tract infections. So for men or women that are getting recurrent infections or interested in prevention, this is a very strong option that's available. Cranmax has been clinically tested. It contains or is made with a unique delivery process called BioShield, which actually protects the compounds, the beneficial compounds in the cranberry, allowing it to be absorbed and utilized by the body. And consumers can feel confident that when they choose Cranmax, they're choosing a product that is based on clinical research and will deliver benefits.
As a scientist and as a consumer, how important is it, do you think, that people really learn to understand what a clinical test is rather than anecdotal, and to make sure that they're really looking at the right kind of information when they're taking advantage of something like Cranmax?
Well, I think clinical research is very important. How else do we know that a product works? Certainly anecdotal evidence gives us an indication, but unless a product has been clinically tested, and the gold standard is a double-blind, placebo-controlled clinical study. Double-blind meaning that neither the participant nor the researcher know what is being tested, what product they're getting. That's the double-blinding. Placebo control is comparing the active compound to a placebo, which is like a sugar pill or a blank pill, and having the results published in a peer-reviewed clinical trial is very important, so in a peer-reviewed journal. And with Cranmax, there has been significant clinical studies, and in fact some of that research has been published in very reputable medical journals, such as the Canadian Journal of Urology.
So it's really important to know everything you can about something you take to help a health condition.
I think so, and when we're looking again at Cranmax, if you compare the benefits of Cranmax versus other juice, powder, supplements, or even just taking cranberry juice, only Cranmax has undergone a significant level of clinical testing to really demonstrate the benefits for safety and for efficacy.
And it can be something that's very efficacious for us to take on a regular daily basis as well.
That's right. This is the type of supplement that I would recommend a person take on a daily basis for prevention of urinary tract infections, but also for just optimizing health. We know there are secondary benefits to taking cranberry supplements such as Cranmax, in that it supports good gum health, it can help lower cholesterol levels, and have some anti-aging benefits overall.
And has very high antioxidant properties as well.
That's right.
Thank you.
Thank you.